to keep the United Kingdom safe. So what we've said, and we've said all along, is that we will continue to look at the rates, and if we see rates going up, we would have to take action.
OK, I've got to speak to you about obesity this morning as well. I know there's lots of questions with regards to what's going on with Spain. Thank you for addressing some of those this morning. On the issue of obesity, we've seen this with previous governments trying to implement measures in the past. I think 2 years ago we saw a big focus on this. So what is different about these measures? Is it just what we saw 2 years ago reheated?
No, this is a big, bold and ambitious policy to address what we know is one of the greatest health challenges of our time. With 2/3 of the adults in this country being overweight or obese, 1 in 3 children leaving primary school overweight, 1 in 5 leaving primary school obese, and the consequences of being overweight are really serious. The health consequences of that, for instance, a much greater risk of diabetes. And then what we're seeing with COVID is much greater risk of complications and indeed of dying if you are seriously overweight. And so that is a real moment for action. What we've also got now is a point in time where many people have changed their habits in recent weeks and months. It's almost been like a reset. It's a moment to take stock and, for instance, start exercising. You haven't been. It's an opportunity to make some different choices about the food that you eat. And so this is a comprehensive policy which includes, on the one hand, giving people the support that they want, the help that you want in order to control and reduce your weight if you're overweight, and also tackle some of the influences which are encouraging people to make unhealthy choices that they probably wouldn't make were it not for the advertising.
OK, I wanted to ask you some specifics about some of the details. The front page of the Daily Telegraph, I have an article from your boss, Matt Hancock, saying that GPs' pay will be boosted for increasing the number of overweight patients that are referred to slimming clubs. Is that right? And how much pay?
So something says we know that if people have a conversation about their weight with their GP, it's a very effective moment to talk about your weight. People.
So will GPs will they get a pay rise? Will they get a pay boost if they do that?
Well, I'm not going to go into the specifics of that. But
your boss has said that this is written by Matt Hancock, who says GPs will get a pay boost. I'm just wondering how much.
So what I can say is that we will look at making sure that the incentives are there for GPs to have these conversations with people. That this is just one of the interventions that we're taking. Another one is promoting an app, an NHS app, which enables you to do a 12-week weight management program, which if you do a program for 12 weeks, that length of time has been shown to really make a difference, so that you're much more likely, if you've changed your habits during that time, to continue healthier habits afterwards. And that is both about eating healthier, losing weight and taking more exercise. So we're going to support people to make the sorts of decisions that they would like to make, but it can be really hard to actually do so in practice.
Some of the concerns have been raised by people who've looked at these policies. One is around calories, for instance, for example, being published on menus for certain restaurants. Because when we've spoken to ministers about face masks in recent weeks, the response back has always been, we trust the great British public to act on that because of common sense. And yet, you know, in a restaurant, surely you know that a bag of chips is going to have far more calories than a plate of salad. There's an understanding of that, and it's far more to do with nutrition, isn't it, rather than basics about numbers of calories.
So this policy and set of policies is informed by the evidence, by the guidance of the science on what works, what will help people. One thing that we know is that people tend to eat more, to consume more calories if they're eating out. A large proportion of the British public is eating out. We don't want to stop that, but we want to enable people to make informed choices. And actually the information that the science tells us is that many people don't know the calories in the things that they are eating, particularly when they're eating out. So this is all about helping people make informed choices.
Surely most people know that salad is healthier than a bag of chips.
What I think is helpful to say is that, again, this policy is drawn on the evidence of what will make a difference to help people make the choices that they want to make. And I absolutely be clear on this, is that we know that though many people are overweight, most people don't want to be overweight. It's just hard to make those choices that would help you lose weight. And one of the things is that becoming overweight doesn't happen overnight. it's a consequence of, over an extended period of time, eating a little bit extra for many, many days at a time. So it's something that builds up gradually over time, and losing weight is about changing those habits. And we want to give people the information and the support so that they can do what many people want to do.
Are you concerned there's a bit of mixed messaging out there, because the Chancellor next week is offering discounts for eating out, including fast food restaurants as well? Is that sending the opposite message to what you're talking about this morning?
Well, on the one hand, we know that it's important for the economy and for the hospitality sector for people to get back and to be indeed eating in restaurants, eating in pubs. But that can be hand in hand with making the healthy choices. So on a menu, there will be a range of options. The important thing is there's the information to enable you to decide and to know, actually, the number of calories in what you've consumed.
Helen Whately, the Care Minister, thank you for your time this morning. Good to talk to you.
And just on that, actually, we're speaking to Tom Watson, former deputy leader, who we know went on a big weight loss programme about that and what worked for him and what he think might work as well.
Yeah, well, I'm not sure what
Shortly,
time that comes. He's coming
minutes.
up in about 10 minutes' time. OK, we're also talking about an end to the Premier League season.